Hi, grad school dragons. Well, it is Thursday before Labor Day weekend, and I wanted to post this piece of lecture because even though we're not having class on Saturday, I don't want to fall behind, so I'm going to put this up. This is very important because it concerns how you're going to put together your assessment, okay? So I want to go over it piece by piece, and I put the source of where I got the information from and from my own writing as well. So when you write an assessment report, and that's what you're going to do, based on everything that you've done, you're going to have 4 subjects. You're going to give each one of them, one gets 1 test, one gets 2 tests, one gets 3 tests, one gets 4 tests, and you have to write an assessment about all of that, okay? So we do assessment reports for several different reasons. And basically, there's 4 broad things that we're looking for. Number 1, you had a referral question. Someone referred to you, and you were doing assessments. You did the assessments, and what were your clinical impressions about your patient that you work with, client? 2, you want to give additional information to a referral source when it is relevant. It's like a court, for court diagnostics, or for competency, or for custody, or something like that. 3, you're creating an assessment for future use. Maybe the assessment is something that they're going to use to compare one diagnosis with another. I'm trying to get that glare out of my glasses. Or number 4, you're looking for a specific court of action. You're looking for some sort of summary. A court has asked you for your opinion, and they're making a decision on the case. Usually that comes from a judge. So one of the things you got to keep in mind is always assessment reports are subpoenable. So you have to be very careful what you put in there. It has to be as dispassionate as possible. So you don't want to do an assessment report and take one side or the other, something that can be used in court for nefarious purposes, if that is so. So it's for a wide audience. A lot of different professionals. Could be social workers, could be parole, probation, judges, could be any kind of people. So you have to remember it can be people who are different, in a different field than you. And here's the list of people, usually social workers, psychiatrists, teachers, physicians, parents, judges and attorneys, schools, counselors, neurologists, physical therapists, rehabilitation therapists, counselors, judges, and other assessors and attorneys, okay? So keep that in mind when you're writing it, so everybody's not going to have the same background as well. And the assessment will also give those people an idea of you. What is your training? What is your school of thought? What are your areas of expertise in the field? And, there's a lot of good assessments out there, and there are a lot of bad assessment out there. So this is a combination of, your statistical interpretation of results and, your clinical impressions of how you're going to solve the question at hand, whatever that may be. So the data is important. You're going to learn how to score every one of them, and you need to put that in the report, okay? And you have to present it in a way that you don't lose sight of the person in front of you or of the question that's being asked, okay? So you have to explain what's going on in great detail and how the person responded when they were with you, okay? Not just looking at the test scores or a particular profile, because the test scores, usually they'll have a key, and the key will tell you it means X, Y, or Z. But given that, it's also important to know what's going on during the testing, okay? So there's 3 types of reporting that people use, and usually they pick one and they always stick with that one. And you can tell, like, oh, this is so-and-so's report. They always do it this way. And so sometimes the court will use, especially the court will say, I like the way this person gets to the point, summarizes the data, makes their conclusion. We're going to go with this psychologist or this counselor, and that's how that works. So the 3 types of clinical reports that you'll see are the concrete, the mechanical, and the individualized. Okay, so the concrete sticks to the data. This is a stick to the data type reporting. They give you the scores. They generally don't go beyond the scores. They say, this is the test. This is what the test is looking for. This is the way the test is scored. And this is what this score on this test means. Okay, so they're very much sticking to the data. That can be bad and good. If it's good because, you know, you don't set yourself up for cross-examination, like over-interpretation or vague interpretations or something like that. It's bad because you're just sticking to the data and you're not giving enough of your impression usually. And that's what they're looking for. They're looking for your clinical impression. So it depends on how you want to go into it. Do you want to stick to the data? Do you want to do something between that or whatever? At the mechanical level, you look at the differences among the subsets. So a lot of the scores, a lot of the assessment tools that you're going to get will have subset scores. And the subset scores tell you additional things beyond what the test is for. So at this, the mechanical level, you draw conclusions, but they're really based not only on the overall scores, but on the subset scores as well. And at the individualized level, that's where it's totally the opposite of the first one, where you draw conclusions, you integrate background information. All of you are going to have to do an intake. That person who does the individualized assessment goes beyond all of the scores and looks at background information, looks at the behavior that the person is reportedly there for, and the behavior that they're presenting with during the assessment as well. So this type, the third type, looks at explanatory data and qualitative data. So if you want to really go in and give a big explanation, a lot of places really like that. But then if you get to court, it's difficult because you can set yourself up for cross-examination, and that's never pleasant. Okay? So I think that this is your first time out, and you're not going to, hopefully you're not going to do any kind of subpoenable thing. And it just takes practice. That's all it takes. And you'll get the idea when you start doing them, which one suits you the best. And you have to put yourself in the situation, well, what if I was in a court situation? Would I want to give this much information? How could this, what are the vulnerabilities of my interpretation? Could they be attacked in court or something like that? So yes, you will need your DSM. You need either your DSM or access to a DSM. Makes a great graduation present. Might as well tell your loved ones that, hey, I need a DSM. It's a great graduation present. So if you're going to go into this kind of area, you're going to need it. So you're going to need access to the DSM. And there's some in the library as well. So what are the contents of the traditional assessment report? And I listed 20 there. Okay, so you have to put your name and their name. Okay, your title. So your name with your MCJFP in back of it. Right now you put MCJFP student. Your age, their trade, their occupation, yours as well. You'll have a thing, the very first page will say about you. And you'll have all the information about you, what school of thought you favor, or if you favor an integrated report, integrated schools of thought, what works best for you, all of that sort of thing. You are the evaluator. And then the reason for the referral, and you will put down academic, okay, because that's what this is. It's an academic exercise, okay? You will not have access to prior evaluations. You may get into a situation where you're working with the student and the student says, I have a diagnosis of anxiety or something. You're just going to have to take their word for it. You're not going to say, okay, let me see your diagnosis. That's not appropriate, okay? You're just going to have to take their word for it. They may expand on that. I find that sometimes students do that. So that all goes in the background information as well, and for prior evaluations, okay? They may know a lot about their previous diagnoses, reports, and referrals, and what other practitioners have said about them. And you want to know all of that because you may see something different, okay? And that happens more often than you would think, okay? You want to, if you can, and if they agree to it, record your responses because you may miss something the first time as you're recording it. There'll be a lot going on. You're going to be thinking, trying to concentrate. Is this the right assessment? Should I be asking this question? They said this. Where do I put this? And you're taking notes. If you have a recording, excuse me, if you have a recording, it might help you organize a little bit better, but they may object to it. If they object to it, that's fine. You don't do it, okay? So you should take note of what they're doing. Are they agitated? Are they sleepy? Are they tired? Are they slurring their words? Are they nervous? Ask them how they feel maybe at the beginning. So this relaxed thing, it's, you know, no pressure. I will tell them ahead of time that this is just a class exercise as well. You want to make note of the tests that you administered and the procedure that you use. Also, when, where, and how the test was conducted. You may find that if you do testing in the morning, that people respond better than in the afternoon. Or if you're doing 2 tests on someone, and you say, okay, meet me in the morning for this test and in the afternoon for this test, you can see the difference between how the individual responds. Are they a morning person? Are they an afternoon person? Are they more agitated in the afternoon? Might that have something to do with the results that you obtain? Things like that. So those things are all very important to know. You want to know the test results, the data. If you do any statistical analysis, which you probably would be, you have to see the normative data for the test, and I'll give you that in class, and how do they compare with the normative data of those tests, and are they presenting differently, and then maybe why. Okay, why are they presenting differently? Remember, you're doing students, so you're not using a psychiatric population. You're looking at, please make the report very readable. Use subheadings. You can go by memory, you can go by recollection, you can go by the type of test. So you may do 2 different tests that test the same thing. If someone says to you, yeah, I had a lot of problems with aggression when I was a kid, you're going to get several kinds of aggression assessments. So do a couple of different kinds of aggression assessments and see if one has the same sort of scores as another, and if they're same, good, you have some reliability, and if not, why are they different, you think? Is one test better than the other, and why, okay? Maybe it's the person, maybe it's the test, okay? So that was test discrepancies. Academic assessment results. If the person says to you, I have learning disability, and you say, well, I'm going to look at learning disability tests, so you report that too. What is that showing you? All of your observations. So you have also a summary and a diagnostic impression and conclusions. You may not have a diagnostic impression. Now those are different. A diagnostic impression is different than a diagnosis. A diagnostic impression just gives you an overall, I think this person is within the normal distribution, and so I don't see any diagnosis. If you're going to go ahead and give a diagnosis, you better support it. You better support it by the test results, by the normative data, and the DSM. Now in the DSM, they have a section in all the different diagnoses that has 5 of these 7 things, presenting with 5 of these 7 characteristics. So you can use that to bolster your conclusion if it's present. You're going to have a wide variety of people. They're not going to have diagnoses, every one of them. So stop trying to give them one if there's none warranted, okay? So really think about the normative data. What is normal behavior for the person that you're seeing, average, 18 to 23-year-old in college, okay? If you have recommendations where you think that they need a treatment plan or they need a referral to someone, you have to ask them what town they're from. That's part of your intake. And then you have to look at what kind of services are available in their town, and if you think they need to go someplace, you have to give a recommendation in their town or nearby that they can see someone. So you're going to have to go do some digging with that as well. And in the appendix has all your test scores, the tests themselves, your signature and the date, and your professional affiliation, which is your student MCJFP, your credentials, and your position. So that's basically the contents. You have to decide how to make that flow and how to summarize it, okay? I'm going to do part 2 here in 1 second. We're going to continue with this.